So welcome. This is the last transition booster session of the year. We're very pleased that everybody is finding them helpful and interesting and hopefully giving you some questions to ponder as your children are approaching adulthood, or if they're in adulthood already, which is why you might be here. You're ramping up your knowledge and taking good use of the information here tonight and our speaker. So my name is Amy Clausen, by the way. I'm with Ohio Family to Family. I've worked with a number of wonderful teammates to put on all of these booster sessions this year. So before we begin with Dr. Tyler and the presentation, I really do want to recognize them so that you all know who they are as well. And by the way, we did agree as a team to continue on in 2018 with these sessions. So thank you. That makes me really happy, and the whole team really happy that you're excited about it. So the planning partners, again, we all just gelled, so I can't say enough about them. They've been wonderful. We've all been happy to do this because we just feel like these sessions really need more time and repeated over and over and over again for many of us, me included, right? So the Eisner-Goen group is Elaine and Scott. They're the ones who provided us the space all year. So we're very happy that they had partnered with us and helped sponsor these events. Erin Hinkle is wherever she's at. She might be in the other room. Erin and I started Partners for Community Connections, and we have flyers at the back of the table. That next event is coming up early October. So she's another mom, just like me. And Wendy Spitz is here from Live Special. There's Erin. And Wendy's here somewhere as well. So thank you to Wendy and Erin. Nessa Siegel is a retired advocate, and she's not here tonight, but I truly want to thank her. Cindy Glazer from the National Council of Jewish Women. The council has also been very supportive of these boosters. They supplied the binders for everybody all year long to use. Laurie Kowalski from the Upside of Downs is somewhere here or out front. Thank you to Laurie. There's Wendy. That's Wendy. Rena Wertheim, don't forget about Friendship Circle and reaching out to your local support groups. Friendship Circle is a wonderful support in Gates Mills as well. Rena's not here tonight. And Tim Lewicki, the man of the hour, so to speak. He's always our guy at the table, and we really do appreciate Tim and the county board's support with all of these sessions. Thanks, Tim. Amber Smith from University Hospitals Center for Comprehensive Care. She's their social worker and just a great lady with a lot of knowledge. We hope that you ask her any questions that tonight or next year. And Jocelyn Eskenazi from the Cleveland Clinic Center. Centers, what do you call it? Where's Jocelyn? The name changed, the Cleveland Clinic Center for Autism, correct? So she has been extraordinarily supportive, and Ann Markoff was retired from CVAC here on the east side. So we appreciate all the committee members helping to make tonight and all the sessions possible. So I truly have, just a wonderful appreciation of physicians and healthcare workers who offer their time and knowledge, especially when we know they've already worked probably way over 40 hours this week. and still come out and do outreach for families to learn and be the best they can be in support of their loved one. So I really do appreciate Dr. Tyler coming tonight. He has been a huge advocate for adults with disabilities, and we're happy to have him here tonight from Cleveland Clinic, and I will let him take over from here. Thank you.
I'd like to thank Amy and Ohio Family to Family for the invitation. I just want to also thank Amy for being a part of Developmental Disabilities Practice-Based Research Network. So, you know, we all are trying to work to improve the lives and the health and health care of people with developmental disabilities. And so everyone's input is important. And so, so thank you, Amy, for being part of that effort. That's actually a research network supported by the Cleveland Clinic and started by Case Western Reserve University and the Cleveland Clinic. And so thank you. I think in terms of transition, a good starting point is the reality of physicians' education, or in many cases kind of lack of education or limited education regarding developmental disabilities. And my story kind of, I think, is very typical. You know, I finished medical school in the 1980s and started practice in a semi-rural area several hours south of here. And I was taking my first vacation after finishing residency training. I had done actually a year of psychiatry at the University of California, Irvine, and then 3 years at Fairview Hospital, affiliated with Case Western Reserve in family medicine. Was beginning family medicine practice next to a cornfield. And my first vacation, I was flying up to Minnesota to do my favorite thing, which is wilderness canoe trip. And the man next to me was a regional manager for REM, which is a large national residential service provider. It was the 1980s, and people who were with developmental disabilities were living in state institutions. Apple Creek was the one closest. Were coming into the community, and they needed physicians to provide care. And so he asked, he was sitting on the plane next to me, he saw I was reading medical stuff, and we got into a conversation. He asked me, you know, would you be willing to see some of our folks? And I had to honestly say, after 4 years of college, 4 years of med school, a year of psychiatry training, and 3 years of family medicine training, I had to admit, you know, I really didn't get much education about people with developmental disabilities, but I'll give it my best shot. And so I started to take care of adults with developmental disabilities. And I try to learn everything I can from everyone and anyone who would teach me. So I was listening to nurses, and I was listening to people in the disabilities field and the service provider field and psychologists. And I started to look at the medical literature, and I found, and at that time it wasn't the internet, of course. You had to go into the hospital library, and they had these big, thick books called Index Medicus, and you know, try to look about articles regarding the care of adults with developmental disabilities. And very little was being written about that population, our population. And after about 10 years, I was so frustrated that, you know, there weren't a lot of people focusing on people with developmental disabilities, that I sold my share in the practice, came to Cleveland, went to Case Western Reserve, learned how to do some research methods, got certified in teaching geriatric medicine, and started an academic career. And since then, my focus has been looking at ways to improve the health and healthcare of persons with developmental disabilities. And so presently I'm Director of Geriatric Education and Research at the Cleveland Clinic's Family Medicine Residency Program, which is based at Fairview Hospital presently. We're going to be moving to what used to be Lakewood Hospital next year. But a third of my patients are adults with developmental disability, a third are frail elders, and then a third kind of any age. So that's my practice, and kind of that's my background. And I am always happy to speak in the community and share what I know, just as over decades people have shared with me what they know and what they have learned. So thank you for the invite. So, presently, again, my patients are mostly adults with developmental disabilities, and I'm typically on the receiving end of transition. But as a family doctor who was trained to see and provide care for people throughout the lifespan, I can kind of talk about both sides of the health age spectrum.